If you follow the world of medical imaging, you know some pretty big news just landed. For the first time in over 10 years, the official rulebook that radiologists use for breast cancer screening, it's getting a massive and frankly long overdue upgrade.
So let me ask you this. Imagine you take your car to 3 different mechanics for the same rattling sound, and they all use completely different words to describe the problem. It'd be chaos, right? Confusing. Well, that's kind of the challenge that was starting to brew in breast imaging.
See, here's what was happening. For the last decade or so, the technology for finding breast cancer has been leaping forward at an incredible pace. But the actual language, the specific words and terms doctors were using in their reports, well, that hadn't really kept up. And this timeline just lays it all out perfectly. The last big update to the medical dictionary for this stuff was way back in 2013. Since then, we've seen powerful tools like 3D mammography become totally standard. So for more than a decade, radiologists were working with amazing new tech, but they were kind of stuck using an old dictionary.
And that is the heart of the problem. When the language you're using can't keep up with the technology you have, it opens the door for confusion. You could have reports being interpreted differently from one hospital to another, or even between 2 doctors in the same building. A fix was definitely needed.
And that fix is finally here. It's the brand new BI-RADS v2025 manual from the American College of Radiology. The best way to think about it is like a universal translator created to give everyone, every doctor, every hospital, one single, clear, and consistent language for breast imaging. You know, radiologists have a whole toolkit of these different imaging methods, from your standard mammograms and 3D tomosynthesis to really advanced stuff like MRI and contrast-enhanced mammography. And in the past, the way a finding was described could actually change depending on which machine found it. This slide just sums it up perfectly. We are literally moving from a system where each machine almost spoke its own dialect to a single unified language. So now, a suspicious spot can be described in the exact same way, whether it was first seen on an ultrasound, an MRI, or a 3D mammogram. Now, the official term for this whole idea is harmonization. It's all about using what they call modality-neutral terms. It's a pretty simple concept, but it's incredibly powerful. It just leads to way better clarity and communication for literally everyone involved. Okay, so let's get into some real-world examples of how this new language actually makes things clearer. It's all about shifting away from words that could be confusing and moving toward terms that are just precise and consistent. This is a great one. The old term microlobulated could sometimes get confused with a similar-sounding word, lobulated, which means something different. So they've just replaced it with the much more straightforward term indistinct. It just cuts out any potential for confusion, which is the whole point.
And this one? I find this one fascinating. The new manual is getting rid of informal, food-based descriptions. No kidding. So a term like popcorn-like calcifications is now officially described as coarse. It just makes sure the language is professional, scientific, and understood the same way everywhere.
Now, some of the changes are a bit more nuanced. For example, the term developing asymmetry, which basically describes how something changes over time, has actually been removed from the lexicon. And this quote here shows you the careful thinking behind it. They worried that focusing too much on past changes could sometimes overshadow what's happening right now. So, the bottom line is this. The official report will now focus on what a lesion's features are right now. This change is all about making the assessments more reproducible, which is just a way of saying that if 10 different radiologists look at the same image, they're much more likely to describe it in the exact same way. But this update isn't just about shuffling words around. It's also about officially bringing the rulebook into the 21st century by integrating all the modern tools that have become common practice over the last decade. And you can see here the manual is finally caught up. It now has standardized language for these newer technologies like contrast-enhanced mammography and automated breast ultrasound. And it fully, properly integrates 3D mammography, which, let's be honest, is a total cornerstone of screening these days. Okay, so we've talked about new words, we've talked about new tech. But why does any of this really truly matter? This is where it all comes together and has a real impact on everyone, from the patient to their family doctor to the specialist. As you can see right here, the benefits are huge. For patients, it means reports that are just clearer. For doctors, it means more consistent diagnoses and way better communication between the radiologist who reads the scan and the doctor who ordered it. And for the whole healthcare system, it means we can track screening results and outcomes much, much better. So let's just boil it all down. If you're a patient, here are the 3 biggest things this means for you. 1, your reports will be clearer and easier to understand. 2, you can be more confident that your diagnosis is consistent no matter where you go for your scan. And 3, this kind of standardization helps researchers improve screening quality for everyone over the long haul. At the end of the day, it really comes down to this single point. The very language we use to find and talk about breast cancer has gotten a massive modern upgrade. It's clearer, it's more consistent, and it's finally aligned with today's amazing technology. This is a huge foundational improvement for breast cancer care. You know, this update was a decade in the making. It really makes you stop and wonder. With technology moving faster and faster, what kind of incredible breakthroughs in clarity and early detection are we going to be talking about 10 years from now? Definitely something to think about.